Okay, I think we'll get started here so that I'm just going to record the meeting in case if anybody wants to join in, you can hear what did we discuss. Okay, so my name is Neil Muchumdar, and I just to give you guys a brief introduction, I've been into this space of health tech and digital health, AI, and data for the last 15 years. I've worked across various countries in different projects related to AI transformations and digital transformations, electronic health records, and all of this area. So now we are in the age of AI, and this is highly important that we all get or make sense of what's going on in this space and just get ourselves into the game of how can we make sure that we can be really smart enough right now. Okay, so we have got two more speakers in our panel today. We have got Dr. Santosh Pandey. He is the CEO of Tata Medical Hospital, and he has been a long-term academician. He is a PhD in healthcare quality from BITS Pilani, and he has tremendous amount of experience in complete healthcare landscape in the Indian subcontinent as well as internationally as well. So he will be joining with us soon for a few part of the lecture. And also we have Ms. Devlina Bhattacharya here. She is a health informatics specialist and she is based out in Canada. And she is also a healthcare operations leader who has worked in various countries across the world, mostly into healthcare operations, like your administration, management, scheduling, all of these areas of the hospital. And recently, he or she also moved into the health informatics domain, like building solutions and innovating for the space of healthcare administration. So we have got three speakers here today. We are going to take you through um, a brief overview of really what's happening in AI in healthcare. I know there's a lot of LinkedIn articles, a lot of media around this, telling that there's a lot happening, which is true. But what we have tried to do for you in this webinar is to cut down and to make sure that you get exactly what you need to know. Okay, so what you will see in the slides here is really what we have tried to do is just give you a crisp overview of what's going on in AI in healthcare. I assume people who have joined here, they are from the healthcare industry. You may be a clinical, you may be non-clinical, you may be uh, associated with the healthcare industry in any form or the other. So this, we have kept this webinar pretty open because we wanted to make sure this appeals to a wider range of the audience here, what we have. So what we are trying to cover is Gen AI. So AI is pretty big, and the first fundamental concept that people should get is AI is not equal to Gen AI. So Gen AI is a subset of AI. So all of these tools that we are talking of today, like ChatGPT, Perplexity, Claude, all of this is a part of our Gen AI toolkit. So AI is much bigger than that. AI has been in existence for the last 50 to 60 years. But right now, the focus is really how well can we use Gen AI to make our lives better, to make ourselves more productive, and make ourselves more smarter. Okay, so we will touch upon some of the areas that really AI has been able to gain a lot of traction in the healthcare space. So one of them is the clinical documentation. We have seen that clinicians spend more time in treating, and this is particularly true in the Western healthcare landscape. Like they have a lot of documentation to do. They spend a lot of time in treating. So a lot of administrative tasks are what they have to do. But we have now solutions like AI scribes and summarization tools, which actually helps them a lot to save time and make things really faster so that they can get more time for patient care and the administrative burden is reduced. The second example is the revenue cycle management. The entire piece of doing this insurance claims in the hospital and also doing this medical coding like ICD, CPT, all of these areas. There has been a lot of inefficiencies which has been built in before. Right now with Gen AI, you can really cut across a lot of them if we use technically or tactical way to make sure that you are using Gen AI to reduce all the inefficiencies that has been built in. So that is one of the areas. And in this webinar, I'm going to show you actual tools which are existing out there in the market right now, which you can go and use right after you drop off the call today. So this is the value that I wanted to give to the audience here, not just doing some slide presentations on AI in healthcare, which you can download and which you can get from anywhere. But this is just to set the context. Um, Now, next we have the administrative efficiency. This is where AI is playing a lot of roles. So I went to a conference in New York for the AI in Healthcare Forum for HIMSS, and there we talked a lot about how well we can use AI to really capture this low-hanging fruits like administrative efficiency, scheduling patients, calling patients, sending an email, sending the customer relationship management, all of this. So this is where AI plays a big role and it makes it faster, it makes it easier. So you don't need to type one email 100 times. So you have AI which will automatically send emails to the patient before an appointment, before an upcoming appointment. They will let the patients know when is the time to reschedule, when is the time to book a follow-up. You don't need manual interventions for all of that. But while I'm telling all this, the whole purpose is not to take people's jobs. So people get it wrong most of the time that AI is going to replace jobs. It might not replace job. What it will do is, if you are an employee who has good understanding of AI, you will be much better positioned in the market to get jobs, to get hired, to get promoted, all of this. So this is the only difference that AI is making right now. Okay, so there is another component which is called the patient engagement component. So the patient engagement is patients have a hard time really understanding the medical terminology. So if you are a doctor, if you're a nurse, you are quite versed with all of these medical terms. But to a patient who is really, let's say, for example, a cancer patient, so that person would be interested to know in simple layman terms what he or she should do, what he or she should follow in terms of the diet. So right now, the prescription, all the medical documentation that the hospital is issuing to the patient, it is very complex and it has a lot of medical terms, medical jargons, which is not easy on the patients. So this is an area which actually AI can play a big role. So they can create patient-friendly handouts, number one. Number two is they can have multilingual health information right at a click, right? If you want it English, French, Spanish, Arabic, whatever language your patients are, you can directly transform that patient education material to that in few seconds. This is the efficiency that AI is bringing in. Pharma. So our friends from the pharma industry, pharma, biotech, and the drug discovery. There's a lot of AI which is being infused into the process. Previously, a new drug discovery used to take around 6 to 8 years, but now with AI in the space, things are really getting sped up. So things are really happening in a faster rate than what it used to happen before. So that is one of the big areas, and we are planning to launch a specific course for pharma and drug discovery, where we will teach you exactly where you can use all of these Gen AI tools in your job. So this is one of the areas that we have been doing a lot of research. Okay, this is a no-brainer. So data and decision support. Healthcare, we are sitting on heaps of data right now. We are sitting on piles of data, hospital data, clinic data, insurance data, medical coding data, all of this is there. So you need tools to help you to make some meaning out of the data that that you have. So this is where your data and decision support, clinical decision support is one of the big areas where AI is playing a big role, and it will be playing a big role. Okay. And so these are the few areas that we have seen that AI, Gen AI, to be very specific, is playing a big role right now. Now, in order for you to be proficient in this, you need to acquire some skill sets. This is what we are going to talk about next. So I'll pass it to Miss Lena, and then we can just go from there.
Thank you, Neil. Hi, everyone. So as we step into the AI era in healthcare, success isn't just about knowing the technology, it's about mastering a new set of core skills that will define how we work. So now let's look at 5 of the most critical ones. First is prompt engineering. So this is the art of asking the right questions and framing inputs in a way that allows AI tools to give accurate, relevant, and clinically useful outputs. In practice, it's like learning how to speak the language of AI. Second, tool proficiency. Just as we once learned how to navigate the EHR systems, healthcare professionals now need to know how to use the AI tools safely and also in a responsible manner, and making them a part of their daily workflows without disrupting any care. Third one is critical evaluation. So AI is powerful, but it's not infallible. So we must be vigilant in checking some outputs for accuracy or bias and the reliability. So it's always about keeping patient safety in mind. The fourth one here is governance and compliance. The regulatory and ethical landscape around AI is evolving rapidly, we all know. So healthcare leaders must understand the rules and manage risks and ensure responsible adoption. Finally, talking of ethical considerations. Now, efficiency gains are important, but they can never come at the cost of patient trust. AI must always serve a human-centered approach to care. So in short, thriving in the AI era isn't about replacing clinicians with technology. It's about equipping us with the skills to use AI wisely, responsibly, and ethically in the service of better healthcare. Can you have the next slide, please? Okay, so let me start with a big number, $200 billion. So that's the projected value of AI in healthcare market by 2030. And this isn't just about financial growth. It's about a seismic shift in how healthcare will be delivered, managed, and experienced. Now, here's the bigger picture. AI is no longer something which is happening on the sidelines. It's rapidly becoming the backbone of clinical workflows, hospital operations, and even patient engagement. So whether you're a doctor, a nurse, an administrator, or a researcher, AI literacy is becoming as fundamental as digital literacy once was. Now let's think about it this way. Perhaps a decade ago, not knowing how to use an electronic health record meant you couldn't function effectively in most healthcare environments. Today, the same will be soon true for AI tools. So if you can't understand how to use them, evaluate them, and apply them responsibly, you will find yourself left behind. So, the jobs of the future will not just require medical knowledge or administrative expertise, they'll demand AI fluency. And those who embrace this change will be positioned for leadership and resilience in a healthcare system that's transforming right before our eyes. So, in short, I'll say AI isn't optional anymore. It's the pathway to staying relevant, impactful, and future ready in healthcare. Neil,
Okay,
I'll pass it to
that
you now.
is great. Thank you, Daplina. So I think these are really good key points to just be aware of the market size in which we are talking out, and that's the reason it's very important for you all to get trained and upskilled in this highly fast-moving domain at this point of time. So I think Dr. Shantosh, are you online? Okay, I think we will just let Dr. Santosh join in a few moments. But yes, so we will just move on here. So this is your journey to AI fluency really starts here because we are a dedicated group of individuals residing in different parts of the world. We have people from India, people from the United States, Canada, Australia, and the UAE. So we are a diverse group of people who are really started this company called Health Tech X Academy, and we are launching a new series of courses, which is Gen AI in Health. So I think Dr. Santosh, if you want to come in now, it would be good.
Thank you, Dr. Neil. Can you allow me to share my presentation?
Yes, yes, sure, please.
Is it visible? Because I can't see my screen myself. So
Yes, 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 yes. It is good. Please go ahead.
okay, thank you for inviting me. I'll be briefly talking about the ethics and governance of AI. So I'll just begin with this case. Like, the AI has been so popular, and we discussed about the different cases of AI in different part of the healthcare, especially. So just imagine a 5-year-old child with vomiting, loss of appetite, mild fever, headache, and cough and cold visits an OPD, and the hospital is very technology savvy, and they have implemented the Gen AI and AI app where the first screening happens with the help of AI. So the after the diagnosis, the X-ray was taken and all that went to AI. Kind of analyzes the report and then classify this as a minor cold, which was actually pneumonia. Since it is a very renowned hospital, the patient relative trust the system, and it was a minor cold, so they didn't go to the hospital for the subsequent visits, understanding that it will be get cured in due course of time. And therefore, delays hospital leads to worsening of the condition, and of course, the treatment condition, because so a lot of other complications happens to the patient. So if we see this case, who is responsible? The first question is it developer who has developed the AI app, or is it the hospital or the regulator? Right? So obviously the developer was responsible because they may not have trained the AI app in a proper manner. Maybe data was not robust. Maybe the exposure to the data was not for all kind of thing, not all kind of cases, a variety of the scenarios and all that. So the accuracy got compromised. Hospital is also obviously at the kind of responsible, because hospital could not ensure that what the software they're implementing, is it transfer, is it having the high level of accuracy, reliability, or is it used only as a kind of final decision making, or AI is only a kind of support system. And regulators, because before coming to this the AI model into the market, the system did not enforce that it has to be kind of undergo through a trial and get certified, and then only it comes to the market, so that it doesn't create harm in the organization where it is implemented. So therefore, I mean, AI, whenever the AI, we need to handle ethical and governance issues, right? And with that, we need to understand that. So we all know that with this lot of example and this example, that AI has become a kind of force enhancer. So it is not replacing the individual, but it actually helping people to do the task more efficient manner, and of course reduce the redundant work. But at the same time, it is kind of creating a newer level of risk, and which means that has to be handled. And so we talk about AI ethics. AI ethics is those guiding principles that is responsible during the development part, during the deployment part, and at the same time when it is used, so that it reduces the risk of the getting the adverse outcome. So these are the few components of AI. When we talk about AI component, the first thing is, of course, transparency. Was the system clear about the accuracy limits? What is the accuracy, or to what level? If you go to a surgeon and the surgeon says that there is a 90% chance that any critical care surgery, like bypass surgery or any kind of cancer onco cases and all that, that the success will be 90%, 95%. And then patient will understand the some amount of risk for undergoing a surgery. Likewise, did the system claims, AI system claims that what is the accuracy level? Fairness, was the model trained across diverse population, as I said, children, rural areas, urban areas, Kolkata, different zone, because we have some geographical uh, differences also, which affects the outcome of the care or the presentation of the care. The accountability, did the company disclose liability? Was the doctor in the loop during at the time of development or deployment or making a decision making and all that? And these are the different kind of guiding principle, which actually tells us that are we using the right tool in the right context, in the right context, or in the right manner or not. So AI ethics rule, whether it is Gen AI or AI, it is like it ensures that system is designed and used in a way that prevent harm and ultimately build the trust among the patient and the healthcare providers. So kind of ethical issues, there has to be a regulatory mechanism. There has to be some kind of governance mechanism, which we call it data governance or AI governance, which actually help that and ensure that the whatever system it is there, whatever checks one has to do is actually done or not, right? So for example, these days we have a VPAT, so vulnerability test analysis is done before, at the time pre-deployment, whether the data creates any kind of confidentiality risk. Is it compromising the confidentiality part or the privacy part? Is it kind of introducing some kind of risk where somebody can hijack your system and get the private data unwantedly? Audit trail. Sometimes if there's a change in the data, somebody manipulates the data, the system manager or the organization leader should be able to kind of have a understanding that yes, the changes were actually made, and it when it was made, why it was made, who made it. So that kind of trail has to be there. Certification, like in India we have ISO, globally we have ISO certification. In India we have NABS certification also. They have come up with the digital certification program for all the HMIS. So any HMIS which is going to be used in country, especially in healthcare system, so that has to be, if they get NABS certification, that ensures that all the ethical rules, regulation about confidentiality, transparency has been, and the other security issues has been taken care of, right? So data governance, when we talk about the AI ethical rules, regulations, a governance system has to be in place, and so that we can bring the trust among the users. So whenever we're talking about any model and all that, as a manager, as a user, as a hospital administrator, or the healthcare leaders, we should be having a system in our organization, and whereby we can sure that be rest assured that the ethical issues has been taken care of. So just imagine that the story we discussed about the misdiagnosis. Uh, if we had the ethical guidelines and the governance system, probably the before buying the software itself, the organization would have make sure that if it is not highly reliable, it is not accurate, then probably we should not use this system. Maybe we should not buy it. If we buy it, maybe we should not use it as a final concluding kind of app, rather than just a support to the healthcare provider, to the doctors and nursing staff on the duty. So definitely, for all these reasons, very reasons, I think we all understand that ethics and governance issues is very, very important, and we must be keep have a framework in the organization, so that the Gen AI is truly trustworthy in this. With this, I think there are a lot of things I think we can discuss. Yeah, we are coming up with a new soft program from the month end, or maybe in the first week of the October. So any of you who wishes to introduce, join, we will be soon sharing this organization the profile of the program, and whoever is interested, you can connect us, and there we will discuss the ethical and governance issues much in detail. Thank you so much.
Yes, thank you, Dr. Santos. It was really very important to discuss this topic here, because there is no AI without the proper guardrails, without the proper ethics and the governance that we should really understand. So AI is moving so fast. It's also at times very lucrative that we just go on to any AI tool and try doing something. But if we are dealing with patients, if we are dealing with healthcare, so we have to be a little careful about before even touching any tool or even trying to use it for patient care. Okay, with that being said, I'm just going to share my screen for the second part of our webinar today. Okay, so in this part of the webinar, as promised, I'm going to show you 10 Gen AI tools that are out there in the market, and that which you can use right after the call. So since we don't have a lot of time to explain exactly how to use each tool, what I will do is I will show the slideshows and you will get the names, and then I will go and show you the actual websites or the systems where you can try and play around. But this is you can be called AI proficient only if you know to use these tools well. And that is exactly the reason we are the global experts. What you see in the call and also many more, we're coming up with a course which will train you with all the tools that you need to know. So number one tool is called the Glass Health. So Glass Health, what it does, let me just see if I can share the website. Okay, what I will do just to make sure this is seamless for all of us is I will go through the names of the tools that I'm going to show, and then I will switch on to the all of the websites, and then I'll let you know that these are the places that you can find those tools. Number one is called the Glass Health. What you can do in Glass Health, you can upload any messy clinical notes, and they are going to give you a structured clinical note. So it is completely SaaS based. You can just access it like you access any other website. And all of the tools that I'm showing you here in this demo today are HIPAA compliant. So they, from a privacy and security standpoint, they are really have gotten all the licenses, all the safeguards in place. So you don't need to worry about that. So this is one of the tool, number one. Number two, I'm going to show you is Heidi Health, where you can do the dictation and Heidi will transform that dictation or transcription to a structured note within 30 seconds. This is what Heidi Health does. Number three is clinicalnotes.ai. So you are a busy doctor in a clinic and you don't have time to really type and things. So whatever is going on in your head, whatever you discussed with the patient, you just put in there in clinicalnotes.ai, and this will give you a very good, well laid out structured clinical note as per the CDI guidelines, the all of the international guidelines. Number four is Hather AI. So you have got a patient sitting in front of you and you want to explain the patient in their own language what is cancer or what is diabetes, what are the impacts of them. So what Hather does is it translates the intricate medical technology to clear, understandable language for patients. This is very useful for patient education. It improves shared decision making because these days your patients are not sitting for your advice only. They are going online to search about what is going on with them, what does the prescription mean, and they are much more informed than the patient that we had 5 years before. So why not really help them? Why not be a part of their care journey? This is your tool for that, Hather AI. Number five is this is particularly useful for people in the administrative space, the healthcare administrative space. So if you want to create a chatbot, no code chatbot with JotForm AI agents, you can do it within 3 to 5 minutes, even if you don't know how to code. Even if you don't know how to code, you can just create any AI agent. For example, you want to create an AI agent for any patient queries that come onto your website, and then the patient types in on your chatbot, and then you as a owner of the hospital or the clinic or the manager gets an email that this patient is asking this. You can also set up generic responses to all those patient queries. So the patient doesn't have to wait. This is very important from the customer relationship management standpoint. So this is something which JotForm AI agents can do. I'm going to show this how this happens. This is number five. Number six is your AI receptionist. So now these days you can have a full-fledged AI receptionist to control your front desk. So although I would not recommend to completely go AI in the administrative or front desk space, but this is something which is coming up. And TrueLark is one of the examples in which they will set up an AI receptionist for you, and you don't need any human being in the clinic, at least at the receptionist. You just go in the clinic, you just put in your name and all, and then there is an AI receptionist who will help you to get to see the doctor. If you want to reschedule your appointment, yes. If you want to do any blood test, yes, they are going to help you. All of this administrative stuff is being taken care by TrueLark. And this receptionist is functioning 24/7. So you don't need to even kind of pay three people for three different shifts. So this is where things are going right now. So number seven is a very, very interesting tool that I found out only last week. I know the founders, they are based in Seattle. This is a tool called Keragon. Keragon, what it does, it helps you to create AI agents specifically for healthcare. So you can create an agent like, okay, I want to capture the queries of my clinic to my Google Drive. And then I want to send those patients who are interested a good flyer of what am I doing. Let's say you run a dental clinic, you run a cosmetic surgery clinic, because these leads are very, very important. This is number one use case. Number two use case is, okay, you are sending a lot of claims to the insurance company and then they are rejecting it. So this is a very, very particular use case that happens. So Okay, let me just admit this person. Okay, so this tool will, and all of the tools that are showing now in this webinar are no code tools. You don't need to know any piece of software engineering to do this. So this is one of those tools. So in some of the countries in the world, you have to have this prior authorizations before surgery is done, and the prior authorization needs to be sent to the insurance companies. All of this process can be automated through this tool. This is called the Keragon. Number 8. So we will all love this. So you are sitting with 25 to 30 different Excel files with heaps of data, and you don't know how to analyze those data. This is a tool where you don't need to have the technical background to create a dashboard in Microsoft Power BI or things. You just upload, and this tool is going to create whatever you want to see, whatever data visualizations you want to see. So this is something which is very, very important for us, for people in the healthcare, because if you work as a healthcare manager, healthcare administrator, a doctor, or a nurse, or a lab technician, everybody needs to deal with some kind of data, and we need a tool where we just upload it, and then we get what are we trying to see from the data. So this is your tool for that, the helical insight. And this is also web based, and this is also SaaS. Number 9 is Julius AI. So this is, so lot of doctors, lot of clinical staff, they do a lot of research. Now this is Julius AI. This is your on-demand AI research assistant, especially for medical professionals, especially for healthcare professionals. You can do a lot with Julius AI. You can analyze the data sets. You can do a literature review within 5 minutes of time. It will scan 300 articles on the internet and give you exactly what to know. So this is your Julius AI. So, okay. So now I think this is number 10, but I do have a bonus for you guys. So this is called Gale AI. This is again one of the SaaS-based tool which helps in medical coding. This tool is revolutionizing AI-driven medical coding. You give any symptom, any disease, any problem, any diagnosis, and you want to know the code, the ICD code, the CPD code of all of this. This tool is there for you to help. So like this, it is not just 10, 11 tools. It is like there are plenty of tools, and we want to teach you all of those so that the next time when you go to your job, or when you kind of go to apply for a new one, you can show your skills. Like, if you know all of this 10 to 20 tools of AI, you are actually much, much smarter than the rest of the world. So this is what we are trying to do. We are not trying to teach you theory. We will teach you practical. We will teach you demo. We will teach you exactly how you are going to build your first clinical agent. Okay, so let me show you the tool sets. Okay, so here, whatever I said, whatever 10 tools that I said, I'm going to show you here live in action. This is number 1, which I said, AI Glass Health, which is AI clinical decision support. And I'm not going to give you a full demo only because we don't have the time. So if you are interested, you can just join our course, and we are going to take through all of these tools that I just said. So this is number 1 that I said, Glass Health, which is AI-driven clinical decision support. You can do a lot of things. You can draft your ANP, draft a clinical notes, ask a question, draft your progress note, draft a patient handout, all of this. Tool number two is your Heidi Health. Heidi Health is a tool. So you can, this is a session, and you can even just try to create a new session, and you can just dictate, and they are going to create notes out of that. You see this start transcribing button? You just go to the transcribing button, and then you dictate something, and you can create your own note within 5 minutes or even lesser. Okay, this is tool number three, which is called clinicalnotes.ai. So the one that I said. So this is where you can also do your clinical note-taking process. All of the Gen AI-driven clinical note-taking process. Okay, so now we are going to the next tool, which is your JotForm AI agents. So this is the place where we will show you how to build AI agents for healthcare. For example, you are a medical receptionist, you are in the administration, you want to build an AI agent for virtual assistants, automated appointment scheduling, define specific actions and workflows. So these are no code agents which we teach you in the course of exactly how to build all of this. So appointment scheduling agent, reminder agents, patient feedback once the patient leaves the hospital. So if you want to get feedback from the patient, you don't need to do anything manually. It is all driven by AI. We will teach you how to set up an agent, and you just run the agent, and it automatically emails the patient, calls the patient, sends the SMS reminders to the patient to provide the feedback. This is the power of AI agents in healthcare. Now, the next one that I said was TrueLark. TrueLark is this one. This is your AI front desk and virtual receptionist. So we are partners with this company, and we will help you get a demo to really understand how an AI receptionist works. How can you automate your front desk? You can save a lot of money. So you just pay this tool maybe $100, which is one time, and then you don't need to hire so many staff. I'm not saying that you don't need to hire any staff. I'm saying that you can cut down on the number of people that you have right now. So this is total cost savings for your clinic, for your hospital. So this is a TrueLark. The second is a very, very interesting tool that I told. It's called Paragon. So this is where you can build your AI-driven, Gen AI-driven workflows. So it's just very easy. You can just create a new workflow here, and you will get a lot of different options. And this is where things get very confusing, because you need to know exactly what to do before you even go to this tool. So this is exactly what we are teaching. So all of this, you can just set up something here, and then you go just click something, and then your workflow is ready. We will tell you how to set this up so that you can start using it right away. Okay, so the next one is, yes, so this is Helical Insights. This is your data analytics and dashboard creators. So you see, you just need raw data sets, and you just need this tool, and here they have given some sample reports as well. For example, you can get some real-time dashboards like this. You can get any part of the body, whatever your clinic is. If you were running an ophthalmology, a dental clinic, neurologist, gastroenterologist, whatever is there, so you can just click, and you can get all of the details right out here. So what you are seeing is I created demo versions. That's why you can see it. In the actual course, we will teach you how to kind of create all of this. Okay, so the next is Julius AI. Julius AI, as I saw, it is your AI-powered data analyst and research tool. So you can So the interface is as simple as you just upload your file, you just upload your data sets, and you can upload it from Google Drive or whatever, and you can add some prompting. So this is exactly what we're teaching, the prompting in the course. And then you can get exactly what you need to see out here. This is all there. This is all in your hands right now. And then this is a Julius AI. So this is one of the last tools that I will talk to you about, from medical notes to medical code. Medical coding is a big industry. You hire a lot of coders. But right now, there's a good probability that you can use Gen AI for this. You can you can create medical codes through Gen AI softwares like Gale AI. This is, you can try it out. It's completely free for 30 days, and then you can decide whether you want to take it or not. But the important thing is to know how to use this tool. This is exactly the skill that you need to have. You have 100 different websites in front of you, but you need to know exactly which one to use, how to use, and how to get the best results from all of these tools. So this is there. And I'll show one more. This is called Hather AI, and this was also there in my list. It's called, so it is also, you can upload any medical document, you can chat with the document, you can create your referral notes, referral letters, and all of this within seconds with this AI tool. Okay, so simple kind of, you just upload the document and you can ask your questions. As I said before, and I think few people joined later, is all of what I showed here in this webinar, this is HIPAA compliant. This is taking care of all the safety security protocols that you need to know in order to use this. So I'm not using a random chat GPT to show you all of this. This is the reason I'm not using a random chat GPT, because chat GPT might not be HIPAA compliant. There are specific tools which have followed the process, a very, very rigorous process, to make sure that all of these tools are HIPAA compliant. Okay, so I have shown you all the tools that you need to see. Now I have a question in the chat, is where can we find the course? This is a very, very good question. I will send you an email after the webinar with the link to the registration for this. If you all do a registration within this week, we will be happy to offer you a discount of 20%. So this is how we have structured this, because there's a lot of time, a lot of energy, a lot of commitment that we need to give in order for us to produce a course like this. So check your email. By the end of the day, I'm going to send you an email. I'll send you a form in the email. So you can just fill in the form with your details, and then we can just go from there. Okay, Pranay is asking, what's the duration of the course? Good question, Pranay. So we have done, I know everybody is busy. I am busy, you guys are busy, everyone is busy. So we have done a hybrid model. So 80% of the course will be on-demand lectures. We will upload the videos, you can listen the lectures. But we want to make sure that you are actually learning. So 20% is a live workshop. 20% is a live workshop that you come here and you do this tool. We will tell you to do some testing and assessments. You do this, and then you get a completion certificate for this. So the course that we are launching is a certificate in healthcare AI essentials. So this is a certificate that we are launching. So I'll send more details in the email as well. So, and I'm seeing Shalini's question as well. Is there a certification available for this? Yes. So we are the ones who are going to certify you. We are Health Tech X Academy. This is a company which is based in Vancouver, Canada, and we have offices around the world as well. So we are only focused and specialized to train people only in healthcare AI, healthcare informatics, and healthcare data. So if you are looking for a trusted source, not just a Udemy course, we can launch this on Udemy. So you can do that on Udemy as well. But what Udemy will not give you is the live interaction, the live session that we want you all to do. Because learning is best when you do it, not just by listening to me. So I want everybody, all the course participants, and we are not taking more than 40 people because we don't want a big mess out here. We want everybody to learn, have a good learning experience. So only 40 seats are there, and so that I know we can manage it pretty well, and then we can start a second batch maybe later on or next year. But I think AI is best if you just do it right now ASAP, because things are moving so fast. Okay, so I think, are there any other questions that everybody have? If you do not have any questions, I'm going to close the call. We will stay in touch over email. I have all of your email IDs. I'll send you, and
Hey,
then
hello. Am I audible?
yes, Archana,
Yes.
tell me.
Yeah. Hello. So I have attended the course of this AI and ML. I think you were also there to guide us. So I just wanted to know if we can got the guide for these AIs. I mean, in some PDF. Is it possible for you, sir?
Yes, it is. It is possible. Archana, I know you have been my student, so it's good. I'm happy that you are really on your learning journey. So I can share the PDF document to people who are present in the webinar, so that you know at least that these are the tools that I talked about. But I'll be honest enough, if I give you 20 different tools and without even guiding you, it will not be very helpful. But still, you can take the PDF, and if you're interested, kind of we can just opening up a more broader course.
Sure, so that would be helpful. Thank you.
Okay. Okay, so I think we need to end on time. So thank you everybody who joined. And if you have any questions, you have my email on the event invite. Just send it to me. I'm on LinkedIn. You can connect with me on LinkedIn. Ask any questions, because my goal is to spread this across the healthcare community through the world. So I'm open for anybody who is interested. All right. Thank you everyone. You all have a good day.